Welcome, everyone. We'll start again. I'm Geraint Rees. I'm the Vice Provost for Research, Innovation and Global Engagement. It is my pleasure to welcome this amazing panel we have for you tonight to talk about digital One Health and global warming. Now, I've been asked just to say a few remarks, so I'll say a few remarks. The first is really to congratulate Patty and her colleagues on the 3rd anniversary of this centre, which is, I think, amazing and exemplifies many of the best things that we want out of digital public health in an emergency. It has not escaped your attention that we have just had a public health emergency for approximately the last 2 years, and it was to do with things that many people on this panel have been writing about for at least the last 15 years, a global zoonotic pandemic. So in my kind of opening remarks, I'd just make a couple of observations. So one is, as we talk about the next global pandemic, lots and lots of people seem to be focusing on technological solutions, virus sentinel networks that will sequence emerging pathogens all around the world and transmit the sequence automatically to some central repository where we will stop the next pandemic. And in that context, I'd observed that the sequence of the SARS-CoV-2 virus was in the public domain in, I think, January 2020. And it made not a blind bit of difference, really, to what happened next. So that isn't to say that digital technological interventions aren't desperately important and could be really potentially useful, but it tells you that public health in an emergency is about much more than that. I think it tells you, first of all, as I'm sure some on this panel will say, that you need to know what happened before the virus. The bat, the biodiversity loss, the population changes, and in fact, interesting things about bats, like why are they vectors of zoonotic disease in the first place? So that's about perhaps an under-neglected area, which is actually research into animal and wildlife health, which some on our panel represent. And then I think on the other end, you need to know, well, why, if everyone knew it was coming, did actually it evolve the way it did? And that's, of course, because us humans were in the loop, and human behaviour, and how societies respond, and how public health is constructed at that social level, and the individual web of incentives and motivations for people to do things is also, I think, important. And so it's bringing all of those things together that is not only important for our panel tonight, but I think is an important function of things like the Centre for Public Health, digital public health. And then the final thing I'd say, the second thing I'd say, is that is also a natural role for universities more generally. Most of the problems that are facing our societies, I would argue now, are complex, multifactorial, difficult, and in fact some people would use the word wicked, in a technical sense, wicked problems. Whether they're things like climate crisis, global inequality, pandemics, you name it. And that's one of the things, of course, that universities are particularly good at bringing together, and I hope we at UCL are particularly good at bringing together, people from different disciplines to work together in a truly cross-disciplinary way to tackle those global challenges in a creative, flexible way. Now, that's not to say the universities are going to solve it on our own. We are part of an ecosystem ourselves, if you like. We are part of a network of companies, governments, agencies, and so on. But I think universities are, particularly comprehensive universities like ours, are the catalytic agents in that ecosystem that can help develop the response both to global warming and to all the health problems that accrue from it. So that's all I'm going to say. I'm going to go to the back of the room and exit at some point. But I welcome the panel. Patty, am I going to introduce everyone by name, or are you going to do that? How are we going to do that? Andrew will do that. Yeah. Andrew over there, Hayward, spelt with an A, not an E, but that's common error, he tells me. We'll introduce the panel. Andrew, over to you.
Thank you very much. And thank you, Patty, for inviting me to this. It's actually interesting. When I was being asked to do it, I was preparing some teaching for our new Masters in Public Health, and I was looking at the history of public health and the sort of big eras of public health, right through from sort of miasma, sanitation, germ theory, health promotion. And actually it struck me that maybe this One Health concept is the next wave of public health, this recognition if you like, of the true interconnectedness of our survival and the planet, and our need for custodianship of the planet and our ability to look after each other is to my mind, that's a new way of thinking about public health. And also within the history of public health, of course, we were teaching people that all the epidemics and the age of pestilence has died, and that's clearly not true. We're still subject to regular pandemics, influenza, 1918, HIV, antimicrobial resistance, COVID more recently. It could come on, and all of those have a zoonotic component, and all of them are deeply connected with this idea as well. So I think studying this, as we say, needs a real interdisciplinary approach, and that's why it's so exciting to have this panel here today to talk about this concept. I'm going to introduce you one by one. My memory may get a few things wrong, but Patty, I think, probably needs no introduction. She's been organising these highly interdisciplinary events for many, many years, and is leading the Centre for Digital Public Health. Has won many awards and really focused on sort of digital public health in emergencies, particularly in infectious disease areas, working for WHO and other groups. And then our next panellist, Professor Andrew Cunningham, is a real top expert in zoology. So at the Institute of Zoology, working particularly on zoonoses. And one thing that terrified me about what you do is your work with bats in Africa, and then their zoonotic infections. That seems quite brave to me, but I'm sure it's very fascinating as well. And then we have Julio Davila, real expertise from around the world in civil engineering, urban planning, and particularly advising on this massive global phenomenon of urbanization, which is changing the landscape and is a central part of this One Health concept. Kate, Professor Kate Jones, ecologist, and so you're at the Centre for Biodiversity and Environmental Research, and I think really it's quite central to your work to be thinking about this interconnection between the environment, between global health and between global warming. So I'm going to be fascinated to hear what you have to say. And then Tiaggio Massoni, I'm sorry if I pronounced this wrong, but from Federal University of Campina Grande, in Brazil, is a computer scientist, software engineer, particularly interested in the some of the aspects of software engineering about how teams work and things. And I think when we're thinking about digital solutions within this ecosystem, these sorts of considerations are really important. So you've got a great panel. They're all going to give you their thoughts on this area. But before we start, Patty's going to just give a little bit more context as to the question we're discussing.
Thank you so much, Andrew, and thank you for staying until the last session for this great debate. So the whole topic, as you have been here for all day, actually have followed, is bringing together the concept, bringing to light the concept of One Health. It's not a new concept. Since my days at WHO, One Health was on the table, but it just hasn't been implemented, hasn't been driven, and we still are stuck with the way of thinking of the animal health and surveillance. For human is just different than the surveillance and the way we treat the animals. These two worlds have not been merged. And I think it's great what Andrew has said. We have to think again how we make One Health topical. Global warming, obviously, it's a crisis. The house is on a fire, quoting a famous teenager. We really have to do something about it, not just for the sake of Earth and humankind on Earth, but also the implications for virus spillovers, for tropical diseases, obviously spreading to middle climates, as we have seen today, presented by Brazil. This is something which is becoming acute in our generation. The question about inequality and poverty, again, has been accelerated by the massive urbanizations, especially in low and middle income countries. And it was exciting to see how many of our speakers from the MIWA project have pointed out how important it is to look into sanitations and water management in the context of preventing disease spread and disease acceleration. But it all links to poverty, it all links to inequality, lack of investment in areas of urban neglect, favelas and townships. So if there's going to be a next pandemic, it's going to be a zoonotic pandemic, or it's going to be vector-borne, and we really have to be better prepared. So this panel will look into from different perspectives in how we can really get our act together a little bit sooner than when the pandemic hits, and how we can increase the chances of responding to the next pandemics through better One Health systems, and perhaps where the technology can help a little bit, but not too much.
Thank you very much. So I think we're going to take it in turn, and you've had your instructions, 4 or 5 minutes. No slides. Julio's ignored the no slides bit. That's all right, we'll forgive you. So perhaps if I could start with Andrew.
Sure. So I think the best way is to sort of talk through how I came into working in the One Health area. So I started working as a wildlife veterinary pathologist back in the late 1980s. And over the next few years, I was mainly working on disease threats to wildlife conservation. And there are 2 main types of disease threats to wildlife conservation. There are the threats to highly threatened, critically endangered species that maybe there's only a few hundred or a few thousand left. And then it's a stochastic effect of diseases that probably have always affected those species. But because they're so rare now, the added burden of the disease on morbidity and mortality is a threat to their conservation. But there's the other group of disease threats to species conservation, and that is where new diseases emerge and cause catastrophic morbidity, mortality, including causing major losses in what would previously have been common species. And seeing the impacts and the drivers of these diseases in free-living wildlife that you wouldn't think had a big issue with human intervention, but the underlying drivers were always anthropocentric. They were always caused anthropogenic. They were always caused by people. And you can see, it became clear to me that the same issues were occurring in wildlife as were occurring in livestock, as were occurring in people. And that the threats to wildlife were the same as the potential and, as we've seen, actual threats to people. So this was sort of putting things into a One Health context. And I start with the wildlife because I think it's really important that when we think of One Health, we're not talking just about zoonotic disease emergence from livestock or from wildlife. We're talking about the health of everything on this planet, of all living things on this planet. So it's about biodiversity, it's about species conservation, but also population abundances of animals and plants, and about habitat loss. And so we shouldn't have this anthropocentric view of One Health. One Health is about everything out there.
Thank you. I think you've summarised that beautifully and on time. So the challenge is over to you now, Julio.
Wow, okay. Thank you, Andrew. Thank you, Patty, and everybody for this invitation. I feel like a bit of an outsider, being an engineer and planner. But a little bit of a story is I came into the urban health horizon about 10, 15 years, 12 years ago, when the Lancet commissioned UCL to write a long report on urban health. And I jumped at the occasion, and I have learned huge amounts since then from working with colleagues in UCL and elsewhere. And I realize how important it is for us planners to understand the issue of health, because the world is urban, it is becoming more urban, and it's getting concentrated. Even if it's suburbanizing in some cases, there are always health implications to all this. So I've been thinking, and my work has been largely in the global south, probably more in Latin America than anywhere else, but a little bit of Africa and Asia. So if I can, oh, there you are. Okay, good. So this is just the summary. I think one project that did a lot of learning for me was this project that this not quite summarizes, but it's from one of the several outputs that have come out of it. And it's an article where I'm not an author, but I admire enormously the work that my colleagues did. This is by James Hassel, who was a postdoc at the time. And this is a 5-year project looking at E. coli in Nairobi. So what is fascinating about this is that you can see several gradients, and I'm just going to stand up and probably point at it. So for me as a planner is thinking, okay, what do we have built environment professionals to contribute to this? As opposed to sort of public health epidemiologists or vets, as in the case of Andrew. And this project involved all of them, and geneticists too. And what you have is, this is like a representation, abstract representation of ACT, but effectively it is Nairobi, where you have on the left not only low density areas, but also rich areas, which is, if anybody knows Nairobi, that's a marker of the highland. And then of course there's all sorts of ecosystems which have been changed. And the further you go inside the city, you will find something which is unusual would be unusual in Latin America, is sort of fairly large inner city slums, very, very large, with enormous densities, which are different in Latin America. And they have a different tenure system. So what you have is not only an issue of density, but an issue of, and that's where am I not being heard? Thank you, good. But also you have the wealth that is showing here. There's a difference in elevation, and there's here the degree of habitat alteration that you find. Here it's relatively untouched or touched by human beings, but generations ago. And on the right-hand side, you've got a whole degree of interventions where you've got essentially a low biotic habitat diversity. But the other dimension, and it relates to what Andrew just said, is you've got high levels of wildlife on this, presumably on this side, but here you've got an enormous degree of synanthrope species. So these are species that like what we do and what we eat, like mice and others. I mean, Andrew is the expert in this, and he'll correct me. But so, just to summarize, because I'm probably going over time now, Andrew, is okay, what is the role of several professions here? And it is important because my research, like everybody is, has to have a policy dimension at the end. Otherwise, I'll feel I'm being completely useless. And so I think in our research from an urban planning point of view, which includes not only the physical environment, but also the social environment, is understanding these phenomena in terms of the slums, density behind that, who lives in there, nature of poverty, and how planning and land use planning actually affects and creates these phenomena. And so that's where our role comes in, is to actually sort of feed into that complex process, which is of course led by people like Andrew and Kate and and so on, not by us. But we're there to sort of help understand the complexity of the process. So that's where I justify my existence in this panel.
Thank you. There's no need to justify it. So let's move on to you, Kate.
Oh, well, thank you, and thanks, Patty, for the invitation, and well done on 3 years. That's really brilliant. So I guess as an ecologist, I'm really interested in picking the links between ecosystem health and the health of the ecosystem and human health. And I've had a particular focus on infectious diseases for a number of years, and I've led some of the seminal work on understanding these kinds of drivers. But I've also worked on bat ecology and evolution of the past 30 years, and so my somewhat niche interests have come together in the last couple of years with the pandemic. So I guess I've got kind of 3 thoughts that I'd like to kind of kick off with, really, about this area, One Health, in an era of global warming. One of them is the dangers of siloed thinking, and you said that, Andrew, and also Garite. And I think that the pandemic has really focused global attention on the role of how ecosystem and degradation of ecosystems is promoting the transmission of pathogens from one set of species into another, and this transmission of pathogens across these interfaces and these jumps. However, this ecological link, this fundamental concept of ecology, and you just talked about it, and you showed one of my PhD students' graph there, figure. This concept of ecology is virtually ignored in public health. And, this is a real problem. And I think that it really severely limits our ability to predict and prevent the next pandemic. If we ignore the fundamental concept of ecology and how ecosystems put together and how species interact. So we need a much more integrated approach which links human health, animal health, and wildlife and ecosystem health together. So unless we start integrating those fields, we're not going to solve this problem. So my second point is about it not being just about climate. So climate is one aspect of a rapidly changing planet. And we talked earlier today about a HEV model of risk, so hazard, exposure, and vulnerability. So if you think about hazard being the kind of animal dimension, wildlife and vectors, and how that poses a hazard of pathogen jumping into humans, then we've also got exposure and behavioural change of exposure to expose human populations or other species to those jumps. And then we've got vulnerability, and vulnerability being a kind of modifier of whether you then get infected by the exposure. So if you think about those 3 things, that adds up to risk. But global change in terms of climate change changes the hazard, changes your exposure, and changes your vulnerability. But so does land use change, so does demographic shifts. So when we start to think about this, it's a systems-wide concept that you need to think about anthropogenic change acting on all parts of this. And if we don't do that, then we won't predict it. My final point is about operationalization of these concepts. So we're really struggling to go from these nice ideas I've just talked about to actually person in the field integrating these ideas into a plan, a plan that operates with the ecologists, with the public health people, with the vets. How to pull that together is really hard. And I think that's the kind of fundamental interface that we need to start to think about.
Thank you. I love your structure to that. And Jiajie.
Thank you. Thank you for the invitation, Patty, and a great opportunity to be here. As a computer scientist, I believe in the power of technology for at least minimizing the problems we're facing. But to borrow one term from the title of the panel, one thing that I learned in these last few years of collaboration with this fantastic interdisciplinary work that we have been involved in Brazil is that technology is not global, I would say. I tend to compare this with the unequal access to technology we had during this pandemic, for example, and the effect this will have in education for the next few years, for the people who doesn't have access to technology and how their education was affected. So differences exist between individuals and social groups in terms of the access to technologies, but also regarding the context we're into. We can say that digital literacy, for example, is a concept probably very familiar with most of you, is that the degree the individuals have and the capacity, knowledge, or motivation to engage and use technology. Taking this out of the equation and just say, okay, this is a problem, we have to face this and have to deal with it. But even though we figure out a way of overcoming this, we still have the context. And the context is so diverse, and that's something that I've been learning. And I'm going to illustrate with the case we have been working with. So that's something that I have at least a bit of knowledge to talk about. We're talking about the work we have with the health workers in trying to control arboviruses in Brazil and other countries. And we're going there and offer them an app for a mobile phone app for replacing the paper forms they use every day and make their work so hard. They are the first layer of public health in these places, usually. These are like probably a list of urgent things that we have to deal with. But the first question is always, okay, but my smartphone is like 10 years old. How can I install this app? It's not even installing. Okay, let's try it. Maybe the government can buy us the mobile phones because we don't have access to those new phones. Okay, let's try it. Maybe we can fix a temporary solution and try to come up with something. But okay, but when you use your app, you need a data plan. Oh, okay, we're gonna fix you a data plan. Let's try it, maybe. But 30% of the city's area is not covered by any carrier. So we need something to make it offline. Probably we have to deal with this. So, okay, let's think about that. It's probably there's a technology-based solution for that. Okay, but let's assume that we are solving all these problems and all these last-minute issues. But then later, one of the agents raised his hand and say, okay, great, but I'm not visiting properties in a few neighborhoods I have to go because my smartphone, the criminals will take it. Because smartphones are very valuable here, especially for drug dealing. Drugs are actually exchanged by smartphones in this area. So if I go with my smartphone, then I will be subject to this. So we're still trying to deal with this. So Okay, right now for pilot testing, for example, we have to go to a temporary solution with the offline app. They go back to the base, and then they will have to register the information in the app, which was supposed to be in field, like using the GPS data for feeding the databases we want to analyze. And perhaps the next step would have to be go to the government and ask them to buy some kind of a specific device that has only one function, and maybe these devices will not be attractive enough for the criminals. So that's what I say. The solutions are not global. So it's very context specific. So we have to think about that, because this is beyond software and hardware problems. So for technology solutions, we cannot assume in specific context, and this is something that we have to care about.
Thank you very much. It's promise and challenge, I think. And we're going to finish back on Patty.
Thank you very much, Andrew. So with my digital public health expertise hat on, not as a conveyor of the panel, when I, 20 years ago, with a fresh degree in computer science, came to WHO thinking how I'm going to save the world by developing database solutions for low-income countries, I just realized, oh my goodness, this is cottage industry. The IT systems just do not work. And learning to work with different professions, learning to work with people who actually are experts in different domains and come from a completely different angle has opened my eyes. And I spent 20 years bridging between computer science and initially public health, making sure public health experts understand that the technology isn't just kind of the IT support you add on to your project budget, but actually it's about just the epidemiology and public health. Actually, both are important to deliver something functional. But at the same time, computer scientists get excited about their fastest machine learning algorithm, and they just use a case study. And the case study could be from public health, yeah, but they don't actually get involved in fully understanding the challenges which need to be solved. And of course, the animal world, as we have heard from experts in ecology and both livestock and wildlife, this is adding the third dimension. We cannot see human health as human health without taking the context of the animal health. So the digital One Health actually is embracing all three parts of this triangle. And it doesn't stop just with the triangle. I think we've seen it at the Ebola outbreak in Africa, how the purely epidemiological approach completely ignored the local practices and how understanding the anthropological part of the social behaviors and like burial behaviors, for example, in Western Africa was one of the key drivers for the spread of the disease. So making sure we also embrace the behavior experts and anthropologists, truly having the understanding that these big challenges are so interdisciplinary, we just can't solve them ourselves. We have to get our hands dirty in working together in teams. I think we are quite good at this in academia. We all get together, and this is an example. This day has been amazing. We have experts from so many disciplines, and this panel is an example. But I think we really have to get out there and not just end up with writing excellent papers from interdisciplinary perspectives, but actually being able to convince the key players why WHO and IOE are still two different organizations in the UN. One responsible for animal health, one responsible for human health, with little interaction. I tried to bring them together to develop some technology solutions, interoperability standards. It was almost impossible. So we really have to go out there and embrace the decision makers, the policy makers, the funders, to make these exciting revelations and research answers actually a reality in the real world. So as we are, as the race, as humankind, genuinely prepared for the next pandemics.
Thank you very much. So we've heard a wide range of perspectives here on One Health in the concept of global warming, and I think what's come across to me is that I think we're all on the same page about the importance of this and the complexity of this in terms of how it is a major threat and potentially an increasing threat particularly for the emergence of zoonoses, but also a wide range of other health issues. But I think we've also come across huge amounts of challenge here in terms of largely due to the sort of siloed nature of people's ways of working, but also in terms of once you start to move beyond theory into the real world to change things, how can we bridge those gaps? And so I thought I'd just start the ball rolling and then open it up to you for questions. But just here's perhaps a provocative first question. I remember when I first started working in respiratory disease epidemiology, and my consultant John Watson at the Health Protection Agency then was saying that the most foolish thing you can ever try to do is predict what the next pandemic is going to look like. Was he right?
No. It might be slightly foolish, but it's not impossible.
But so it always strikes me that we always get the pandemic that we don't expect. So how do we move?
I mean, honestly,
Well,
I think Andrew and I...
Maybe you were expecting it.
Yeah, Andrew and I would tell you that there were the 3 papers at least published about a SARS-like virus in Wuhan that had the potential for spilling over. So the question to me is, why are we so surprised when this happens? Because you could kind of predict, you know what the spillover, the drivers are, which is anthropogenic change in the landscape, climate change, changing the transmission pathways between wildlife and humans. We know what those are, and yet we do nothing. We keep transforming our landscapes. We keep increasing the temperature and the rainfall and precipitation. So why are you so shocked that this happened? That we're not.
No.
Andrew's, we're not at all shocked.
Predicted it 20 years ago.
Yeah, in that region.
But you could presumably also predict 20 other different things that might emerge.
Well, I think you have a good point in that we always tend to think that the next pandemic or the next big zoonotic epidemic is going to be somewhere over there, probably in a tropical country far away from here. And that's probably going to be the case, but it's not inevitably going to be the case. I mean, we know so little about the natural pathogens of wildlife globally, and we're constantly finding new things. Even in this country, we have very limited surveillance or knowledge of what exists in wildlife in this country for the little bit of depauperate wildlife that we've got left in this country. And we're still finding things like, it was very recently we found we've got an endemic hantavirus in the UK. And yet, if you'd said that to public health officials beforehand, they would have completely said no. There's absolutely no way that that's in this country. Mm. So, and Kate's right. It's change that's the issue. It's changing the interfaces between humans and animals, or between animals and animals. And it's people that make those changes happen. We've got a pandemic in amphibians at the moment. It's been raging for at least 30 years. That's wiped out almost at least 100 species. Not just decimated them, it's completely wiped them off the face of the earth. And that's because of humans moving amphibian pathogens around the world and leading to the emergence of almost like a Frankenstein pathogen where hybridization had occurred between pathogens. And I can perfectly understand why people think that the thing we need to go and do now is to go and find out what pathogens are out there in the wild. And you've got the global virome project and so on. But personally, I think they're a bit misguided. because for a number of reasons. One is you can sequence the hell out of tissues from an animal, and you still won't find everything that's infecting that animal. And if you think about it, pathogens that have co-evolved with their host over millennia, particularly viruses, but other pathogens as well, will often be present in those animals in exquisitely low numbers most of the time. Yes, they will sometimes break out and cause viremias and disease and outbreaks and so on, but most of the time they're there in such tiny numbers that we don't have the technology to find them reliably. So we will miss lots and lots of stuff, even if we sequence the hell out of stuff. But pathogens change over time. Omicron, which is now the main SARS-CoV-2 virus, if we can still call it SARS-CoV-2, is completely different to the virus that first emerged in 2020. You know, it's got different tropism, it's got different transmission methods, so on. It's a different virus. So things change, and we can't necessarily predict everything. But what we should be doing is, instead of trying to do to react to things and to find things, react to them, we should be preventing these things from happening in the first place. And there are very simple ways of doing that. You know, we prevent people from getting food poisoning whenever they eat stuff without having to know everything that's in that food. You know, there are control measures that can be taken which will stop bad things happening without having to know everything about what that bad thing is.
Largely conservation related.
It's not just conservation related. It's basically the problem is people don't put the time and the money into this because it's very difficult to say that you've spent $1 million and nothing's happened.
Yeah.
Yep.
It's much easier to wait for something to happen and spend $1 billion and say, look, we've saved people from dying because we've produced vaccines and so on. So politically, it's very difficult to stop something from happening because you can't prove that what you've spent the money on has actually stopped it. And I think that's the crux
The eternal problem of public health.
Public health. I was just going to say it's the crux of the issue of public health in the future, as it has been in the past.
Thank you, that was really informative. So can I, is there anybody who'd like to keep the conversation going with this lovely panel with their different perspectives? Any thoughts? Otherwise I can... oh yes, great.
I have a question. I'm sorry if I'm okay.
Thank you very much. Gianluca from Institute for Risk and Disaster Reduction. I have a question for all of you for reflecting. What do you think are the lessons learned from the pandemic, from COVID, that can be replied or applied to other global health emergencies? So, for example, we are dealing right now with different things can get extreme, not just in terms of pathogens, in terms of technological failures and other stressors that can impact the healthcare system. Did you thought about it? This can be a next challenge. What are your thoughts?
Right, so any volunteers to start with that one?
Thanks very much for your question. There were a few things which I drew from this pandemic. I think the growing realisation of the public health community that it's bigger than just public health, it's planetary health. But also, I think the ecologists realising that they've been talking to themselves for a lot of too much time, and they need to be talking to. There needs to be more connection between different disciplines. But I also think that a lot of this could have been mitigated if we'd had more investment in healthcare provision in countries. So we had less inequality in terms of access to healthcare. So universal healthcare, universal health provision. Coming from an ecologist, that's a bit weird thing to say, but I think that could have if we'd had more investment in that, that would have reduced our vulnerability. And actually, that was one of the biggest problems, I think, of this pandemic. And reducing vulnerability can apply across the board. So reducing vulnerability to climate change, for example, it can also help. You know, I think putting more money into that would have been good. would have been a preventative way, and I don't see how that could be bad.
And I guess related to that, the massive global inequalities in vaccine distribution, just and the whole influence of social inequalities on the pandemic, I thought was something that we should have been prepared for, but weren't really. The other thing, of course, technological solutions, digital technological solutions were tried quite a lot. Do you think we had much learning from that?
Yeah. I was writing down some ideas here. It's just maybe one of the lessons I think we learned is that it's really hard, even if the technology is right or it's important or useful, maybe it's really hard to make people believe it, right? So we probably have to find or devise new ways of being convincing in terms of how you change habits, maybe with the help with technology. And the target is right now is social networks. This is one of the probably a potential solution to a lot of problems which became very important and difficult problem in terms of how society deals with information and how it reaches the people in different places, different cultures. And the business model today is pretty bad in terms of the incentives for doing this. And they are driving the technology advance, the evolution in terms of funding, for example. There are probably most of the important research problems in machine learning, artificial intelligence, and things that the technology is advancing or evolving are coming from these companies, from these social networks companies.
And there's I think the whole sort of spread of information and misinformation.
Especially, and make people actually sort out which is important from what is fake and what is actually bad for them. It's like it's really hard for us to figure out what's the best way of doing it. So,
and Julio, I mean, pandemic obviously transformed cities. And reflections on urbanization.
Yeah, no, that question is a very interesting one, and we're still reflecting on it. There are several panels in my field which seek to move forward, but I think the lockdowns were criminal, to be honest, for the poor, particularly for the poor. I mean, there was an assumption that, countries in low-income or middle-income countries could just copy what was being done in the rich countries without thinking of the consequences. I mean, I still I quoted earlier today, and several of you were not here, but quoted the figure that has shocked me more. London is one of the cities where there is the largest proportion of people who can work digitally, can work from home. The largest figure I've found of people who can work digitally from home is 43% of the labor force, which means 57% have to physically go there, including surgeons, of course, and dentists, but also, the people who clean the streets, people who clean toilets, the drivers, and so on. And somehow governments, and particularly local governments, seem to assume that that was the case everywhere, right? three things we were told not to do, which was sort of, or to do, keep distance, wash your hands, and I've forgotten what the third one was. But, you know, so wash your hands with plenty of water, keep a distance, and work from home. Those were the three things, right? I mean, tell me what proportion of people living in informal settlements in any city in the global south would have been able to do that? None. You know, they can't work from home unless they're cooking for others, but, you know, they try to sell the stuff. They can't keep distance because these are where the higher densities are. And there's no running water in many of these places. So, again, I think some sort of reflection on what these public health messages might be and how to manage, particularly in case of respiratory diseases when you have to keep distances and so on. So there's a reflection. And not to mention transport, which is an area that I've worked on and which was actually criminal too, because we didn't understand, you know, the transmission of the virus, so the issue of surfaces and all that stuff. And of course that has ramifications for municipal budgets, because a lot of public transport systems, if you exclude the informal sector, are feed directly into the budget of municipalities. And we can see it in London. I remember one figure when I was writing something last year, I came across a piece in The Guardian that said that the London Underground had lost £100 million just in advertising alone. That was in the first 6 months. And you know, not let alone the fares. Even London Underground hasn't recovered fully, so you know they keep losing money. Think of a medium-sized city or any city, and that's a huge drainage on public budgets too.
That's really interesting, and I certainly agree that it's got to be tailored to the resources and the setup of the country. You just can't have this sort of blanket public health response that's one size fits all. You can certainly do more harm than good that way. And I might as well, this is a good line of conversation. So, Andrew, do you have thoughts from a zoological perspective?
Well, I would agree with Kate that, you know, we've probably learned that we've been talking to each other too much, and we haven't broken into the policy arena enough. I mean, we really need to engage policy much more, and that's one of the reasons when I was invited I joined this One Health High Level Expert Panel, which is an advisory panel to the World Health Organization, the World Organization for Animal Health, as it now is, United Nations Environment Programme, and the Food and Agricultural Organization, United Nations. So, I mean, they've realised that things haven't been right, and so they've come together to see what could be done, and so, but even so, I mean, it sounds grand, a One Health high level expert panel, and to the United Nations bodies, but how much notice will be taken of it, I think, remains to be seen. You know, you could just despair, I think, because so many people know what the evidence says, and if we're talking about climate change and we're talking about public health, I mean, the biggest thing that we can do is to massively reduce, if not stop, eating meat. I mean, 83% of farmland is used to farm meat, either directly or to grow the food to feed the animals. And yet, only 18% of our protein comes from that. Much, much better use of the land would be to just grow plant food for people. I don't think there's a single human being on this planet who has to eat meat. And yet we know meat is a massive producer of greenhouse gases. It's a massive use of water extraction, of all sorts of pollution and so on. But it's also a public health issue, and it's a public health issue because of the stuff that we eat from the animals, but and so it causes, you know, cardiovascular disease and cancers and so on. but also it's been estimated, or it's been calculated that if the extremely, I get it, unlikely occurrence that everybody on the planet became vegan, 75% of farmland would be freed up to go back to nature. And rewilding is one of the nature-based solutions to prevent pandemics and zoonotic disease emergence. 75% of farmland is an area the size of the United States, the EU and the UK, Australia and China combined. That's massive. That's land that we are using, that we are putting under land use change, that we don't actually have to. We want to, and I can understand that, but we don't have to.
I think the world would be an infinitely better place if we listened to you. Patty.
So thank you for the question, Gianluca. I think that's great to think about what we can learn. I think looking back at March 2020, the beginning of the lockdown, I'm sure all of you remember these fantastic IT ideas that we're going to develop this great COVID tracing app where we can trace people moving around and giving warnings to people to stay apart and stay away where the virus is being transmitted. Even WHO jumped on this wagon, and they initially agreed to team up with a university in Australia and a US company to develop this COVID, I can't remember the name, there's some fancy name as WHO like, COVID app which will stop the COVID basically. I think we learned technology can help, but it's not a silver bullet. And the issue of interoperability and national needs and local needs in low-income countries, trust, is just enormous. And this has been completely ignored at the beginning when lots of money, look at the UK, 38 billion invested in Test and Traced app, which people didn't believe they had to use. They didn't believe the government, which wasn't actually implementing the policy provided and advised by the experts. So I think the matter of trust, both in politicians and in the IT technology, has to be there. And we got into the society where, unfortunately, the three biggest players, and most of us are from Brazil, UK, or US in this room, had politicians in the middle of the pandemics who were absolutely the wrong people for the wrong time. We had Trump, Bolsonaro, and Johnson, needlessly killing people's lives by misinformation, by not listening to the right people, by not implementing the right policies. So I think we really have to step back and look at, can we prevent the situation, both from the zoonotics idea, better public health investments, local public health, which we have ignored in this country, but also how do we prevent to be in a situation where we have such a disconnect between the leadership and what the crisis actually need? And it's a question maybe beyond this panel, but I think that's the ultimate question.
No, I mean,
because then the funding will go to the right place, then the policy will be changed. It all needs to be connected.
But I think that's where, because we're talking about such massive global problems and such massive global coordinated responses that are needed, then ultimately it can't work unless we engage our political leaders in this, as well as we're, belatedly beginning to see with climate change, but obviously not fast enough. And so I'm interested in perspectives on how we can influence more outside of our immediate scientific circles. Small question.
Oh, gosh, I wish I knew the answer to that. It does make you despair, doesn't it? Because we know about fossil fuels and climate change, and we've known about that for a long, long time. It's taken until the pips are squeaking before things are actually before we're actually being told by the politicians that they're going to do things, and then it just needs a slight change in the geopolitical situation for it to all fall apart again. So, Yeah, it's very difficult to sit on a panel like this and not be rather doomy and gloomy. I mean, I'm sorry. Our Prime Minister says we shouldn't be doomsters and gloomsters. But, yeah, can you be an optimist?
Well, maybe you and I can tag team that. But I have seen, I've been, Andrew and I have been banging on about biodiversity decline and populations and climate change for 30 years. I don't know. So, but what I've seen change is public opinion. And you're on this panel. You're chairing this panel. You're a medic. You're a medic. You're
Public
chair.
health, then.
Okay, but that's a change. That is a definite change. You have young voices standing up and saying this isn't good enough.
Thank you very much.
I was thinking about Greta. But you have a change. There is a change, and I went to a kind of pre-pandemic. I went to one of those climate change protests outside Houses of Parliament. Greta was there, and it was really emotional for me because I've been going on about this for ages. Nobody was listening, but then incremental change happens non-linearly, I think, because you go on about it for ages, and then there's a tipping point. There's a documentary, or there's somebody that rises up and says something, and then it can change overnight. And I think, but you have to have that groundswell of information, and at some point it tips, and it has tipped. And I think, how do we get politicians to listen? We have to get the public to care, and then the politicians will listen, because it's votes. It's about votes. So I think it's about tipping public opinion into understanding what's going on, and it being part of that story, part of what everyone knows. It is about climate change or biodiversity loss. That's why we're in these problems.
Yes, maybe I'll qualify my optimism a little bit, in the sense that, I mean, if you look at the trajectory of the rich countries, there's a sizable middle class with a high degree of consumption, which we now can afford to say, well, I'm not going to consume anymore. But when you've got countries that are growing and have aspirations and urbanizing, like China and India, and wait for Uganda to urbanize. Uganda has a population pyramid which is like this, which means there are masses of kids waiting to become adults who are hoping to A, get a job, and B, consume. So, I mean, and Nigeria is going to be enormous as well in sort of 30, 40 years' time. So, I mean, my hope is that cities will help in some way, because you will channel that energy and that sort of massive population into cities. The issue is actually not going on paths which the rich world has gone through, which is high meat consumption and high energy consumption, but find ways in which we can sort of use renewable energies, reduce our consumption of meat and so on. But that has to take its course. I don't think you can say to China with a sort of straight face, or to the India, we've gone through that. Look at our lifestyle, but you're not allowed to do it. Exactly. And that is where the problems come. That's where all the successive COPs fall apart, because there's this arrogance that we can say to these countries that we've had it, you can't have it. And where I despair is in the US, and the fact that it's a largely suburban setup, where you inevitably need individual forms of transport. And yes, all this rubbish about electric cars is going to save the world. Rubbish, they won't. You need to massively mine huge amounts of minerals to produce this new sort of round of cars. And then you have to dispose of the old ones, which of course is hugely polluting, and dispose of the batteries afterwards. And that mining, we know, causes enormous local and planetary changes. And then there's the issue of localized, and it's more and more emerging things, which probably Andrew has no more than anybody else here, which is that, the pollution, they say, well, they're not polluting. Of course they're polluting. They're polluting in the process of production. They're polluting in the process of using them. The pollution that comes out of the rubber tires is local, but it's it's really bad. I mean, it's now proven to affect people's lungs. So, I mean, that's a distraction which actually nobody has really fought against really seriously. They think this is what's going to save the world. So that's where I despair a little bit, is that, you know, we're emulating the US style and becoming suburban. You know, a lot of Latin America is becoming suburban. And that's where I get really worried. And there's something to do around that and say, no, hang on, let's keep it compact. Let's use public transport. Let's not individualize forms of transport.
So cities are actually quite a good thing.
Well, you know, I think they're better than anything else. I mean, the populations will continue growing. We have to fit people somewhere. Let's fit them in places where the ecological footprints are lower, ideally, than, you know, dispersed suburban areas. Or, you know,
That's very interesting. I think, Patty, we probably need to be. I don't know how long you wanted the session to last.
Until half
7.
past.
Until half past. Okay, so we got a little bit more time. Optimist or pessimist?
Well, actually, I agree with Kate. I'm a bit optimist in terms of, despite maybe 20% of the, for example, Brazilian population who believes that the vaccine is Chinese conspiracy for, you know, controlling our minds and bodies, 80% of the population got vaccinated. And they are really they speak about it, and they have important message to the politicians. Even though these 20% that I mentioned are getting informed by these social networks and groups and the bubbles that we know, they are almost impossible to finish or to invade, but probably this 80% that are worried about this, and this changes the lives of everybody. So I think that at least for some habits are going to be changed after this, and I think this is permanent. A lot of people will be more conscious about their health care, or going to the politicians and ask for better services in terms of at least avoiding the terrible effects it had in the lives of everybody. So I think the public opinion has changed, but maybe not enough for maybe avoiding the worst effects of the next pandemic, but at least we probably will not be so anxious and do all the stupid things we have done in the beginning. So maybe there will be the next pandemic maybe will last a shorter time.
You are an optimist.
I don't know. Maybe because of because it was really anomalous, like for the lives of everybody. It affected everybody. So it's something that maybe it didn't happen. It hadn't happened before, at least in I don't know, 100 years. So this is something that we have to consider.
I think we've got someone in the audience was.
Do you have a question?
Did you have?
I have a question about you focus a lot on urban areas.
Wait for the microphone.
My question is, we focused a lot on sort of urban areas. I was wondering, are we overlooking rural areas in LMICs in terms of sort of, you know, disease surveillance and emerging disease threats?
Andrew, do you want to start with that?
Yeah, I could answer a little bit to that. I've done some work on disease surveillance and syndromic surveillance of human health in West Africa, and you would need quite a large outbreak before anybody picked it up. and it would then, by the time it was picked up, it would be too late. The systems currently don't work. And one thing that I'm particularly concerned about, Kate talked about about the inequalities in health provision and so on. Almost as bad as that is that where you put in some health provision, but it's not good enough. So you bring sick people to a hospital, to a central area, to an urban area, but the facilities, the diagnostics, the treatments aren't there. That's a very good way to encourage the spread of an outbreak, and to make sure that an outbreak that may have been very small and contained within a rural area, a village or something, becomes a national outbreak, or even an international outbreak. So we have to be cognizant of that, and that needs to be addressed. And the way to address that is to put an awful lot more resourcing into the provision of primary health care in rural settings in the global south.
I mean, I think that there have been lots of some good news in terms of Nigeria, you know, that they've put in a really amazing surveillance system. Of course, it could do still with some more money and support, but, you know, they've been, you know, I work on Lassa fever in Nigeria, and like having those reports and the systems there that are working is a game changer for understanding how to control Lassa fever. So I think you know, when it's working, it actually works really well. So I think it is a good flagship for how you can improve surveillance and then interventions.
Excellent. So I think we'll probably wrap up now. Thank you for a really lively discussion. I think what's come home to me about this is that, as always in public health issues, prevention is so much better than cure. Prevention and early detection is where we need to be at. If you're responding to a large-scale pandemic, it's kind of too late. And I think the One Health agenda has a huge amount to add to that prevention agenda. Patty, do you want to just say a last word or two to close?
So I would just say, I think it's been a great opportunity to hear all of these voices. Maybe coming from the technical perspective to bring it back to the digital agenda for One Health. I think we need the same kind of revolutions in public understanding and public awareness we are now going through regarding the climate change. People need to understand the implications of digital divide. We can't be part of our population because everything is going online. And at the same time, we really need to invest into understanding how to distinguish between credibility of sources and fake news. We also can't be blindfolded by our governments using emergency as an excuse to allow IT companies to creep into the public health and healthcare sector, which is normally and has to be publicly owned and publicly funded. And this happened in the UK with regards to several IT companies from the US. So I think making sure we raise the awareness, like Greta does for global warming, to better understand the dangers with data being shared with inappropriate third-party commercial players, and making sure we actually invest in the opportunities for technologies to improve One Health for all. I think that's our next task.
Thank you, everybody. A round of applause for our panel. Great. Time for a drink.
Yeah.
So I would like to thank you to the panel, and I have a few final words. So thank you very much for. So thank you very much to the panel, and I have five final words. So thank you so much for staying until the very end. So before the drinks, would like to invite a couple of people who have been instrumental in making today's happen. And we have a little resource, and most of them, except one, are students. So I would like to invite Lan, who's been great in helping with the event, doing all the comms. Aisha, who's been great in organizing the logistics, the IT side of it, and all the travel for our Brazilian and Turkish colleagues. Would you mind coming to the front? And I would like to invite Lisa, she's our new lecturer who only joined us about a month ago. She's been great in getting our fantastic report together and learning about what we do and chasing around printers last minute, so we got the report just on time. And finally, obviously, Sarah, our IRDR events manager and coordinator, who's been great with dealing with all last-minute emergencies, as they always are, but everything at the end very well. So thank you to Sarah, Lan, Aisha, and Lisa.